At Alpha Male Clinic, we actually prescribe quite a lot of injectables, and for those, there are going to be two types of syringes generally. One is going to be a 3 ml syringe, and these are typically more for higher volume liquids like your testosterone injections once a week. The other type of syringe that we have is an insulin syringe. With the 3 ml syringe, these are going to be typically for intramuscular injections. They're going to be a 1-inch needle. They have to go in the muscle, so they're going to be a little bit deeper. The way you want to read these when you look at it, there's little lines on here. It goes from 0 to 3 mLs. Now, 1 is the same as 100 units, 3 is the same as 300 units. If you were going to inject testosterone, for example, you'd basically take your vial, rub it with a alcohol pad to make sure there's nothing on it. You would pierce it, turn it upside down, and you would just slowly pull until it fills up. Now, if you look at the plunger, right at the bottom is where you want to stop. So for 1 ml, I always pull past it and push back into the syringe. Always pull back past the 1 and push it back up to the 1. That ensures that all the air comes out of the syringe and that you're ready for an injection intramuscularly. With insulin syringes, you'll always know it's an insulin syringe because it's identified with an orange tip and an orange cap. These are usually not going to be in milliliters, they're probably going to be in units, which is why I said 1 milliliter, 100 units. It's the exact same thing, two different ways to say it. On an insulin syringe, every increment is going to be 1 unit. So for example, it starts at 0 and it goes all the way to 100 units or 1 ml. These are typically used for subcutaneous injections, in other words, for the belly fat. Normally, medications like Pregnal HCG or MIC injections, vitamin injections, things like that, you'll just pinch your skin, poke it in. Same way you would actually draw the liquid into the syringe, pierce the top, pull it upside down. If you wanted 50 units or half an ml, you'd simply pull to the 50 on here. Now, because insulin syringes are smaller, it will take a lot longer to fill these up depending on how thick the liquid is you're pulling into it. Same concept, if you're going to use 50 units or half an ml, you'll pull past the 50, right around 60 or 70, and then you push back to the 50 to make sure that all the air is out of the syringe and so that you're ready to inject without any air.